Hello everyone, just before I get into the video I just want to do a disclaimer that this story is obviously individual to me, so obviously it's not going to happen to everybody. If you are a first time mum or due to give birth, you don't have to listen to this because it is about birth trauma, but obviously it's up to you at your discretion. But I just want to say everyone's birth and birthing story is different. This is mine and how I'm coping with it. So yeah, here's the vlog. Hello everyone, welcome back to my channel. Thank you for clicking on this video, and if you're a returning viewer, thank you for coming back, and if you're a new viewer, hello, my name is Katie. I am 29 years old. I live in the UK and I am often posting about my motherhood, my house renovation, my crazy life online. Just a little bit of background before I get into this birthing vlog, and why I'm posting so late is because I am a mother of one. I have a 16-month-old little boy called Arthur, and I'm also 30 weeks pregnant with my second little boy, which I'm very excited to meet him, and I can't wait for him and Arthur to play and things like that. But I have got a few issues around the birth, so I thought I'd address it all on here and address my first birthing situation and how that's linked in with how this birth's gonna go. So basically with my first little boy, Arthur, I had a fantastic pregnancy. I was healthy, happy, he was healthy and happy. I was like still painting and I was cleaning at like 9 months pregnant still. Everything was fine, and I did loads and loads of hypnobirthing classes. I really wanted to do hypnobirthing and try and have a pool labour. I wanted to try and go as natural as possible and just try and breathe through my contractions or surges, as you say in the hypnobirthing world. So yeah, I did loads of online courses and loads of like teams with doulas and things like that that I found free on Instagram. There's actually a lot out there for hypnobirthing, a lot of free courses. If you just look on Instagram, Facebook, YouTube, you can find loads of doulas that do free courses or trial courses. I just did the trial courses and never went on to actually do anything with a doula. I just wanted the base knowledge and try and go for it myself. So that was everything really positive up until 39 weeks. 39 weeks come and I was in bed one night and me and Sam went to sleep, and then roughly around 3:30 in the morning I felt this gush or surge of like water just come out of me. When they say it's nothing like it is in the films, it doesn't just burst, your waters doesn't just break, and well, for me it was exactly like that. I was literally in bed fast asleep, and then my eyes just popped open and I just felt this pop and literally this gush of water, and the bed was soaking. Luckily my mum, I don't know why, but she was sleeping over in the guest room, so I got up, woke Sam up, woke her up. I was like, I think my waters have just gone. So she come in and she was like, they've definitely gone. It was like a big pool on the bed. Not this bed, by the way. This is a brand new bed. So it was a big pool of water on the bed. So I just wasn't panicked, was chilled, like learned everything from the hypnobirthing that like anxiety and stress can link to like slowing down labour or causing issues in labour. So I was really chilled out. I rang the midwife and I just said, I think my waters have just gone. There's a big pool of water fluid in my bed. It woke me up, it was a big gush, and she was like, yeah, I think they've gone. Can you come in now? Just so we can check and monitor you. So I was like, yeah, sure. I didn't go in right then. I actually got in the shower. I was like, I'm shaving my legs. I got in the shower, shaved my legs, got all pampered, got some nice clothes on, like a nice lounge set. And then I think I headed to the hospital about 4:30 in the morning. This was on the 5th of September 2023. So yeah, me and Sam headed to maternity triage and she took us in 4:30 in the morning, she did my obs, she checked my pads, and because they told me to put a pad on, just to make sure there's any leakage of like blood or a different type of fluid that shouldn't be coming out. So yeah, she checked my pads and she said, yeah, your waters are definitely broke, but nothing was happening. I wasn't getting any contractions, no tightenings, I was still feeling him move, and yeah, that was it. So she said, basically what happens now is we ask you to go home and you've got 24 hours to kickstart labour yourself. So go home, just go about your business, carry on as normal, don't like just sit there, you know, kicking back. Carry on your day as normal, cleaning things, and then come back in 24 hours if nothing has happened. So we left the hospital about 5 AM on the 5th of September and went home. And then I just went about my daily duties. I think we went for food, I was cleaning, I was just pottering about the house, trying to get these contractions going, bouncing on my ball, squatting, trying everything that I've learned from like my hypnobirthing session and things like that. 12 hours was passed, nothing was happening. I was getting like slight tightenings, but nothing major. So I was like, come on, I can feel something, I can feel like tightenings, come on, get the labour going. I didn't want to be induced, because I know like the contraindications of being induced, being a nurse, like I know issues around there, and I really wanted to do it natural and do it myself. As a first time mum, I was like really determined to like do everything myself. So anyway, 24 hours went past. It was the 6th of September, 4 o'clock in the morning, and I rang triage back and I said, it's been 24 hours, nothing's happening, I'm getting slight tightenings, what do you want me to do? So they said, because of infection risk, I have to go in to be monitored. They can't leave me. I think it was 24 or 48 hours with my waters being broke, they have to intervene. So I was upset, really scared, because I didn't want to be induced, but I just roll with it, you know, clinical midwives, they know best. So anyway, I went in at 4 o'clock and they admitted me, give me a nice little room on my own with Sam, and then the midwife did my first membrane sweep, which I hadn't had because I was 39 weeks and I hadn't been offered one yet. I don't think I would have had one anyway. I think I would have just let it try and happen naturally itself, but I hadn't been offered one, and she said, do you want me to membrane sweep you, because it might bring things on and then you don't have to go down any clinical medications. So I was like, yes, you can membrane sweep me. That was an experience. Obviously I've never had a membrane sweep before, and the midwife was really nice because she knew I was a first time mum and I'd never been examined and never ever had like a membrane sweep or anything like that. She was really gentle. She taught me like through step by step. She did like it bit by bit by bit. She didn't just like go in, because some of them are like so rough. But yeah, she was really gentle, went in step by step. Sam was holding my hand, and looking back now I think I bet they thought I was just getting a membrane sweep. I was holding Sam's hand thinking that was bad, not realising what was to come. So yeah, she membrane sweeped me, and then I think she gave me, I think it was 3 or 4 hours just to see if anything happened. So she did that at 4, say about 4:30 on the 5th of September, on the 6th of September. And then nothing really happened. I was not really getting any tightenings. So then the next shift midwife come on 4 hours later, and she offered me the pessary gel. It's just a gel that's got a hormone in it that tricks the womb into thinking they're actually in established labour. So I said yes to that because nothing was happening. And it was getting later and later. Baby hadn't been monitored, and because it had been so long since my waters had broke, I was open to infection and things like that. So yeah, I said yes, you can give me the gel. And oh my god, that was an experience. Like, it's just giving me like, it's giving me like stress now thinking about it, but that really hurt. I don't know if it's different with different midwives, but she really hurt me with that pessary gel. It's like a syringe, but it's got to go behind your cervix. So they insert it, but then they've got to go right up and then behind your cervix. And oh my God, it was painful. And she was like, I was like, I think I screamed. And she was like, I'm so sorry, but it's got to go behind your cervix. That's why it was a little bit painful. I have like a little bit of trauma / PTSD from my first birth, so this is why I'm trying to speak about it now, to try and get it out of my brain before this baby comes, and talk about like why I'm refusing options and things like that. But yeah, if I was offered the pessary gel again, I think I would refuse it, because although it did bring on my labour, it was very, very painful. And I don't know, I've done my research, and I don't know if induction is also linked to like having more clinical input in your actual birth. So yeah, that's another thing to think about. But anyway, back to Arthur's birth. She gave me the pessary gel, and then that was it. That kick-started my labour. I had the pessary at 8 AM. Once that was done, she was like, we won't be examining you now if you want to have some sleep. So I said to Sam, there's no point you being here. You may as well go home, get some sleep, and I'll ring you again. So Sam left around 8 AM, and then by 12:30, 1 o'clock in the afternoon on the 6th of September, I rang him back, and he wasn't answering because he was asleep. So I rang my mum because she was here with him, and I said, you better get him up and tell him to come to hospital, because these surges of pain I cannot cope with alone. So yeah, from 8 till 12 I tried to sleep, tried to cope on my own, but then around 12:30, 1 o'clock in the afternoon, I was like, I need Sam with me, I can't cope. So Sam arrived at 1 o'clock, and the pain was getting worse and worse. They gave me dihydrocodeine, I was bouncing on the ball, I was literally stood up on the window like that, and it was ramping up. So by 5 o'clock I was literally on the verge of like begging for someone to make it stop. So I lasted from 1 o'clock till 5 PM just doing it on dihydrocodeine, nothing else. I was actually on the antenatal ward, I wasn't on the labour ward. And on the antenatal ward, they don't give you gas and air, and they don't give you anything stronger, such as like Oromorph or morphine. They won't give you any of that on the antenatal ward. They just give you like a codeine tablet that literally probably wouldn't even help with period pains. So from 12:30, when the contractions were really, really ramping up, till 5 PM, I just lasted, just coping on my own. I just remember holding on to the bottom of the bed. I was on the ball, the birthing ball, because that's the only way I was comfortable. Well, comfortable, I was managing the pain. Arthur was actually back to back, which is supposed to be the most painful labour when the baby's back to back. I was just on the end of the bed on the birthing ball, just rocking like this and making whale noises, Sam said. I had the TENS machine on, I had the TENS machine did help actually. If you don't know what a TENS machine is, definitely buy one off Amazon if you're going to give birth. It's just little pads that go on your back, and they just send electric shock waves to your back. So when I was having a contraction, I'd ramp the TENS machine up, and it would literally kind of like take the pain off the contraction and more on the electric shock. If you've never felt contractions, they're very hard to explain, really hard to explain. People are like, they're like a period pain. Nothing like a period pain. But I know everyone's pain threshold's different, but yeah, Arthur was back to back, and I had hardly any pain relief. They wouldn't give me gas and air, so I was just coping 5 or 6 hours on my own, just doing it on my own. I got to 5 PM and I was begging them. I was like, please, I need gas and air, I need something. But the labour ward was full, so they had to keep me on antenatal just as I was crying. And I don't think that helped. I think that's when I lost my hypnobirthing head. and I was on this antenatal ward, but I just wanted gas and air, or I just wanted to be in a pool, but that wasn't possible in the antenatal ward. So literally just in a room, no pain relief, no gas and air, just codeine with a birthing ball, and she'd pop in every 2-3 hours to make sure I was all right. So that, I think that's where it started going downhill, and I lost my positive, natural hypnobirthing mind, thoughts, and I was like, I can't do this, I cannot do this. I've been going 5-6 hours just in this room on a ball. I was like, I need the epidural, I need it now. But 6 PM come and another midwife come with a wheelchair, and she was like, we have a space on the labour ward for you. And I was like, hallelujah. Getting on from the ball to the wheelchair was impossible. I felt like, just now, just thinking, I just felt incapable because I was in that much pain. And so I got on the wheelchair, Sam helped me, and they wheeled me around to labour ward, and I was literally getting like on the verge of like falling off this wheelchair. I didn't scream though, because I was I'm not walking through, I'm not getting pushed through this corridor, even if I'm in pain. All these midwives were looking at me, and I'm not screaming down this corridor. So I was just like trying to hold it in, but I was literally on the verge of like, I'm gonna fall off this chair because the pain was unbearable. Anyway, so they put me on the labour ward, took me into this lovely room. It was a much bigger, it had like mats on the floor, in my own bathroom. They dimmed the lights eventually when it went dark. But by the time I got to the labour ward, my mindset had just completely shifted to what I wanted it to be. It was very negative. I was panicking because I'd just been left in this pain because there was no space on the labour ward. So as soon as I got there, she gave me gas and air, and that did help. When the surges come of the contractions, I was on the gas and air, but I did want something stronger. I did ask for an epidural, but obviously they don't come like there and then. That's another one of my anxieties, which I'll speak about once I've spoke about this birth. So she gave me morphine for the meantime. I could not cope with the pain. I'm not too bad with needles in my bloods, but I don't like people cannulating me. And there's like different sizes of cannulas, and for the maternity you need the biggest one, the biggest needle, and I was in that much pain I literally did not care that they was cannulating me. And I'm really bad to like take bloods and cannulate. I don't know if I can't remember, but I'm sure they tried a few times, and I literally just didn't care that they was doing that. And that just shows how much pain I was in. So yeah, they cannulated me just in case I needed to be rushed to theatre or I needed emergency blood. And she said, I need to get you on the bed to examine you. So this is where I feel like it knocked me even further. I was in a negative mindset, but I was okay. Then she said, I need to examine you, and because it was back to back, the only time I was managing these contractions was on a birthing ball. I couldn't walk, I couldn't stand, I couldn't lie on a bed. There was no way, I just could not stand the pain. But she had to get me on this bed. She helped me to get on the bed, and I just couldn't. It wasn't the pain of her examining me, it was the pain of the contractions. I couldn't cope. So eventually she did finally try to find my cervix, and I was 5-6 centimetres dilated. This was about 7 PM at night on the 6th of September, and that just knocked me back even more. I don't know if on these hypnobirthings and doulas they do say you don't actually need to be examined. They don't need to tell you how many centimetres dilated you are. Your body will just do it. You just wait for labour. And I think a lot of mums who are examined and they're not where they should be or not where they want to be, it knocks them back even more. So when she said I was 5 centimetres dilated, that any positivity, which there wasn't much, there was no positivity, but I'd say there was a little bit, that was gone out the window. I was so done with like labour and birth, and I was like crying, saying I can't do this, I really can't do this. And then my knight in shining armour of the anaesthetist, I was like, thank you so much for coming really quick, because I think she was only 40 minutes, half an hour. And obviously being a nurse, I know when you call on a doctor, they can be in an emergency, sometimes it takes hours. But yeah, she was really, really quick, the doctor. I was like, yeah, I don't care about the consent form, let me sign that, because the pain, I could not take it because it was back to back. The pain was unbearable. So yeah, I signed the consent form and she gave me the epidural. I didn't even feel it go in because the relief of like just getting a bit of relief from them contractions, I didn't even feel I'd do it. So the epidural was in about 8-9 o'clock at night, and I could literally like calm myself down a little bit. The lights were dimmed. The new midwife come on shift and she was lovely. She was actually one of the midwives in charge, and she brought a lovely student in. Yeah, about 8-9 o'clock I got onto the bed and just relaxed. It's really hard to explain. I wouldn't say the epidural failed, but I could feel the contractions, but they wasn't as painful as they was previous. So I knew when a contraction was coming on. Normally they have to put the hand on the belly and tell you, or normally they have to tell you when to push. I knew when to push because I could feel it. The epidural was only working down one side of my leg. I don't know if anybody knows this, but when you have an epidural, sometimes it goes down one side of the nerve more, so they ask you to lie on your side, so it goes on the other side of the nerve. For me, I think it worked on my left side and it wasn't working on my right. By this point I had the heart monitor around my stomach because they was monitoring Arthur's heart rate all the way through the labour, because I think it was dipping but nobody was telling me. Me and Sam weren't aware. 9 o'clock just up until 2 AM. I could relax a little bit. I could feel the contractions, but I wasn't in agony, and I could speak to the midwife and tell her how I was feeling and blah 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 blah. So yeah, 2 AM on the 7th of September. I was like, she never told me. I said, I'm getting urges to push. So she examined me and the student did, and they said, yes, you are 10 centimetres. Yes, you can have these surges to push. So why the midwife and the student and Sam were at the bottom of the room, just because the room was so big, just having a chat. She said, if you want to push now, just try a little bit while we're just all here. She said try. So I was pushing, and then she said if nothing happens in an hour we might have to call some help. So I was pushing for half an hour, and then around 2:30 she put my legs in the stirrup and she was like really like coaxing me to push, but not really telling me anything. She was like, come on, you need to push now, you need to do it. And then before I knew it, the emergency buzzer was pulled, and she said to me, loads of people are going to come rushing in, his heart rate's dropped. And then next minute, oh, it's making me sad thinking about it, but next minute they said, we was in room 9 at the time, and they said room 9 paediatric emergency, room 9 paediatric emergency. So yeah, literally about, I think there was loads of doctors, loads of surgeons, all healthcares, like just loads of people, like men, women. They come in, and it's literally like a blur now thinking about it, but it is triggering. Like it's so hard to explain, but they said we need to get forceps because he's stuck. It didn't help that he was back to back, so he was face up. I think that's the reason why he was stuck. They got the forceps and I was pushing with them and nothing was happening, so they gave me a episiotomy. A episiotomy is basically just a sharp blade, and they cut you the perineum or lateral just so they can get the baby out. So they cut me and they was pulling again. What I didn't know, and I don't think Sam knew at the time, you can only pull on the forceps, I think it's 3 times. The 4th time you have to call for a more qualified surgeon to do it, or you have to be sent to theatre. So the 2nd time she pulled and nothing, so she gave me another episiotomy. So that's my 2nd one now. Bearing in mind I could slightly feel it because the epidural wasn't working all the way. And then the 3rd time she pulled, she had a foot on the bed and she was pulling. Everyone in the room was just like, come on, you can do it, push with her. Sam, I think, was just stood there like a ghost. And then the 4th time, I tore. So I had 2 episiotomies and a tore. And then the 4th time, the surgeon come in and she took over and she pulled the 4th time, and he did come out. He was stuck for 12 minutes. He would not come out for 12 minutes. They put him straight onto me, but he wasn't breathing. He was just like flat blue. So they took him straight off me, literally put him on me for like 10 seconds, rubbed him, nothing was working. They took him straight off me and put him on the resus trolley. And then it was just a bit of a blur by then. I just remember crying. I don't know what Sam was doing. And I just remember him looking down his throat, or putting the tube down his throat and trying to get him breathing from himself. A paediatric doctor was there at the time because he took Arthur straight off me. He put him in an incubator and took him straight to baby intensive care, and that was Arthur whisked off. They said he's stable, he's breathing, he didn't like arrest or anything. They just brought him back to breathing on his own, and they put him in an incubator and they took him to baby intensive care. And then I was just, all these people like left then and followed Arthur to make sure he was okay, and I just had like the surgeon, the midwife, a few other people in the room, and Sam, and I was just left to be stitched. Then that took around 2 hours because I think there was a lot of damage and trauma. When they were stitching me, I don't know if they turned the epidural off or it just didn't work, but I could feel them stitching me. So they had to give me lidocaine, which you're not supposed to do because it makes your blood run more. So that was a palaver. I think I lost quite a lot of blood. I can't remember how much they said, but I was like so off needing a transfusion. I lost quite a lot of blood, and after they finished with me, normally after that traumatic account, they make me stay in bed, but I was like, no, I want to go and see my baby. I wanted to get up, see my baby and have a shower because I was just covered in blood. The gown was covered in blood. The 2 HCAs, healthcare assistants, helped me get up into the wheelchair. They took me around to intensive care and we seen Arthur, and it was really sad. His head was all swelled. Obviously he had a massive tear here where they tore my forceps, and he had a massive scar on his head, and all this head was out. But he wasn't like intubated or anything, he was just literally being monitored. They let me take him out, give him colostrum, which was really good. And then once we'd seen him for an hour or two, I think it was about 5 o'clock in the morning, so they said please go and try and get some sleep. So we left intensive care, went back to our room, and we had a couple of hours sleep. So that was like the main bit of the birth and how traumatic it was. At the time I didn't think I had any trauma or issues around it. I was like, he's here now, that's that. The surgeon actually come to me the next day and said, are you okay? Do you want to talk about what happened? And I was like, no, I'm fine. It is what it is. I'm honestly fine. He's here now. But I realise now I'm pregnant again, and after 16 months, that must have been like a coping mechanism, or like my mother instincts must have just kicked in and my adrenaline just put all the trauma and stress and everything to the back of my brain, so I couldn't actually think about what had happened because I just had this baby to care for. So yeah, I didn't want to speak about it. I was like, no, it's fine. And that's that. I think I stayed in hospital for 1 or 2 days just in case we had an infection. I was put on tablets because my iron obviously was extremely low. And then we were sent home. Following the send home, I had a lot of issues post birth. My wound down below opened up and it was open up for 10 months. Obviously they couldn't restitch it because of it was open to bacteria, so I had a lot of in and out of gynae, in and out of triage because of that reason. That was really, really hard as well to like, I couldn't get on with like daily life, so that bothered me. Obviously now everything's fine, I'm healed, everything's back to normal. I thought, you know, me and Sam wanted another baby, and I thought I'm fine, that I've got no issues. But coming on to getting pregnant, and now I'm 30 weeks, I actually do think I have got a bit of PTSD or a bit of trauma, because I'm now petrified to give birth. Just thinking about it, like I literally could burst into tears. So obviously the midwife is aware, and she's put me at a higher risk because of my birth trauma, and because of that I've got a few options. First option is obviously a C-section, but I really don't want a C-section. I've got a toddler and a house to run still. I don't want to have major surgery and then not be able to do anything for a couple of days or weeks. Obviously it's major surgery as well. I don't want that to happen. I want to breastfeed as soon as baby comes out. I don't want him to be like wrapped up and given to dad. I just want skin to skin breastfeed the most natural way, and I think that's all taken away when you have a section. So I've said, can we try and avoid the section if possible? Obviously because I was induced last time, I don't want to be induced again, because they give me hormones that weren't supposed to be in my body. They weren't natural. So I don't know, I did say to her I would like to do it as natural as possible without being induced and without a C-section. So they're my options and where I'm up to, and I'm 30 weeks now, and I've got time to think about it. But I just thought, I just wanted to get my birth story out there, and it does make me feel a bit better speaking about it. I've never spoke about it before, other than to my friends just briefly, but getting it all out here on a big video does make me feel a bit better, and it helps to show that you guys why I'm so thingy over this birth and what's going to happen. But I will take you on the journey with me. I'll tell you everything, what's going on and how this birth's gone. I'm going to try and video some of it. But yeah, my camera's flashing and this has been a long one. So I'm going to say thank you for watching this video, and I will see you on the next one.